strategy with the field. So really excited to be here. This will be pretty short. I think, what do we got, 45 minutes kind of allocated for this. But we really want to make sure we leave plenty of time at the end for you listeners, again, kind of out there in the field, to where if any specific questions come up and you want to bend our ear on questions, concerns, comments, challenges that you're seeing from the field, we would love the opportunity to answer any specific questions that you may have. But we're excited to be here. We're excited to host this conversation today. And yeah, I think we're going to jump in. Everybody's good?
Absolutely.
So let's kind of just level set here a little bit. We'll talk a little bit about kind of why we're here today. Last quarter, we really focused on like some on-vessel healthcare strategy, where we really discussed injuries, illnesses, trends that we see on vessel. And a lot of the feedback we received was, well, what are some things that we could do before we even get folks on the vessel to begin with? Like, what type of healthcare strategies are best practice, and how can we implement those at the operator level? So we're really excited today to dive into how can we look at the pre-employment physical evaluation process and make it more effective for mariners. Specifically, we want to discuss ways that we've seen to reduce costs, reduce injuries, and really just ensure we have a truly fit for duty, maritime workforce. And Dr. Turnbow, we haven't talked about this, but I just kind of fun fact before we go too far down the rabbit hole here. I was just curious, I asked the team, how many medical physicals have we done for our maritime workers over the past 8 years? Would you have a guess on that? Like, it's
just in the pre-employment world, or
just pre-employment? Yeah, pre-employment medical physicals.
It's in the thousands, but I have no idea.
25,000.
Yeah, that's
25,000 pre-employment medical physicals really over the past decade.
That probably excludes the number of candidates that we've reviewed their medical records and their pre-employment questionnaire, and excluded them from the actual physical exam. That's impressive.
Yeah.
So, I mean, in talking about the things that we do as occupational medicine providers and physicians, this is what I think is probably one of the most important things, is being sure that you're hiring the right candidate for the right position, and positioning them for success, and your company for success, and being sure they are able to align with the mission and actually perform all the essential job tasks. And so some people don't invest in this, and I think that's a mistake. I think clearly for people who are in ADA job classifications, 4 or 5, very, very heavy job demands, I think it's imperative that you be sure you know what you're getting in your candidates, and that they're at least a setup for success rather than a setup for failure. And I think something we've learned over 25,000 physicals is that having a set mechanism and a protocol that is implemented across the board, no matter where the employee is getting their physical or going through the process, is very, very important from multiple different standpoints. I think we're going to dive into a little bit more why that's important in a minute.
Absolutely. No, I think you teed it up well. I think we just got a good, solid case study of data that we're excited to share with you operators out there today. So let's keep it going. Just a quick agenda. Won't read this verbatim, but we're going to talk about some of the challenges we see with just maritime physicals and maritime health strategy to begin with. We're going to bring up some concepts called the job task analysis and physical demands testing that we think are imperative to this process. We're going to give you guys some real world examples of what we think effective looks like. We're also going to share some kind of, I don't want to call it horror stories, but I know you got some pretty wild things that you've seen in your clinical experience, Dr. Turnbow, as far as like what wrong does look like. There is.
Absolutely.
What's the old adage? There's no wrong questions. Well, there's some definitely wrong examples that we can share with you guys today.
Hindsight is definitely 2020.
Yeah. And really to kind of wrap us up here, we want to give you listeners really just a toolkit and a roadmap to where you walk away from this conversation with some things that you guys could do at your level today to evaluate your pre-employment program and potentially improve it significantly. So we're excited to share with you kind of an implementation plan, if you will. So, yeah, next slide, please. So I won't hit this too hard here, but again, my name is Patrick Howell, CEO here at HealthWorks Medical. I've been in the OC space about 20 years. I kind of grew up in Army medicine and military medicine, which is ironically very similar to occupational health and maritime health specifically when we talk about fitness for duty and readiness standards. I kind of joke with Dr. Turnbow, I'm kind of a data geek, a tech geek. My professional background is in healthcare research and economics. So I love geeking out on a lot of these things that we're going to be presenting today. And I'll turn it over to Dr. Turnbow to talk about his background.
Well, I started when I was 18 working in the occupational health clinic of a large aluminum factory, and my father worked as the superintendent of maintenance. And so I started very early getting exposure to occupational health and the importance of providing good quality care for those workers on the front lines. And as our strategic location here in Paducah, Kentucky, we've had the opportunity and the blessing to be a part of a number of large maritime clients who headquarter here or in the region. And with that, we've just really helped them design strategies to better service their healthcare needs in what we call different buckets, basically, of healthcare, whether that be the pre-employment side, the on-board care, and then following them through work-related injuries and so forth, moving forward into like wellness plans, trying to keep them healthy once you have them in your employee as well. So right now I serve as medical director for a number of companies that you probably recognize. Some of those are probably on the phone call as well. And it's just been a real, we get excited, like you said, geeking out about, the metrics and designing strategies to better provide and deliver healthcare. Is pretty exciting because not many people are doing that.
Great. Awesome. And it's, yeah, definitely excited to host this conversation today. We consider it a privilege to be able to share this information with you all. I think we're doing a quick audio adjustment here. Hopefully that's a little bit better. Thank you, Cassie. So let's jump ahead here let's kind of dive into the meat of this. So let's talk about the problem with maritime physicals today. And Dr. Turnbow, I'd love you as a clinician to kind of share some of the challenges you've seen, because you have a pretty wide perspective on this, right? Like what makes the medical evaluation process so much more challenging in the maritime space versus other industries?
Well, people on this phone call will be intimately familiar with these challenges, but location of the employee is challenge number one, because in maritime industry, we hire from everywhere, all over the country. I mean, heavy predominance in the Southeast, but they come from all over. And then finding, clinicians and clinics that are able to perform, good quality pre-employment exams. And what does that look like? What's the protocol? How you do it in one spot may be dramatically different than the other. So being able to streamline that process, analyze that data consistently across the board has been a challenge. And the other thing that's challenging is that people are not always truthful. I know this is hard to believe, but sometimes when people want a job, they fail to disclose a number of significant healthcare issues that they may have suffered from in the past, previous injuries, work-related or not. And so we've designed our process to help us be able to vet those out, to be able to identify potential problems before they become the responsibility of the employer, and before they can create a health and safety issue upon our vessels.
Yeah, no, that's great. I appreciate that insight. A thing that I might add here too, and I think you kind of loosely hit this, that the risk associated with these positions is just so unique and exponentially higher, because these guys are literally operating in an austere environment, right? A fitness health related issue for them, whether it's emergent or not, even some of these just acute sicknesses can become very significant problems very quickly, just in the nature that these folks operate.
Yeah, and I think oftentimes pre-employment or post-offer physicals can just turn out to be a check the box, right? And I know for a long time in the DOT world, or FMCSA, motor carriers, that's what it ended up being. I mean, any chiropractor or any practitioner on the corner could sign the box, and then you could have free reign to operate a very large 18-wheeler up and down the United States interstate system. And what they discovered is that creates problems. It creates some significant safety hazards. And so they have uniformly decided that there are some standards by which everybody should be held to. The United States Coast Guard has their guidelines, and I happen to serve on the committee who makes those recommendations to the Coast Guard on physical fitness requirements. I think that's important for people who are performing these physicals to be familiar with those standards, the specific requirements, and for offboarding in an emergency, need to be intimately familiar with the clinician, because you can't just, it's not a one size fits all. It's not a standard physical examination for, annual wellness. It's actually an evaluation for fitness for duty.
Yeah. Yeah. I think you hit the nail right on the head. The only other thing I wanted to bring up and maybe get your insight on, Dr. Turnbow, is point number 3 on here on this slide. It says on paper, people can look fit but not be, or vice versa. And I think we hear a lot of horror stories, and we've seen a lot of examples of that. Something we seem to run into a lot is these operators, some of which may be on this call out there listening today. A lot of these folks are kind of bootstrapping these programs themselves and doing the best they can, serving as pseudo, medical evaluators, or building their medical strategy for their program. And we've seen things like whole back, spine, MRIs, and X-rays that are coming back to a HR clerical assistant to read and interpret. And it's like, any comments on that as far as just how complicated this thing really is, and how there's a little more than maybe what's at the surface level?
Absolutely. So interpreting an MRI report can be very difficult, and it can vary as the wind, according to which radiologist is reading it and how much detail they put in it. So it's really hard if you don't have any medical background to be able to interpret what's important and what's not. I also think it's important to have standardization amongst your clinicians who are performing the physicals. Data in is only as good as what you do with it, right? So it is important to have trained medical professionals who look at medical records as they come in, trained clinicians who are asking all the right questions, so that you catch things before you actually have the patient in front of you. And then once you have them in front of you, we train our clinicians on a pretty robust musculoskeletal evaluation. I mean, it's important for the employee to be disrobed and look at the spine to make sure there's not any surgical scars. It's important to look for deformities. Very young people have significant traumas. There's all sorts of motor vehicle accidents, prior work-related injuries, military service injuries, those type of things that you will not know by just looking at a clothed individual. So you have to be sure that you're doing a thorough musculoskeletal and neurological examination, putting them through range of motion and strength testing, which I think Kevin Wynn is on the call will be kind of define a little bit better. But if you're going to design a post-offer process that just entails you sending a form to the candidate and asking them to go to their local doctor or the local doc in the box, you're going to get a dramatically inferior product. Right? Because I promise you, you can go anywhere in this country and you can get some clinician to sign your form without doing almost anything. So that's not what this is about. This is actually about identifying people who are healthy, and both physically and mentally, to safely perform their essential job task. And that's important not only for the employee, not only for the company, but also for the people who work closely with them in very dangerous scenarios.
Yeah. I think you teed that up really well for kind of our next section here. Is like, okay, well, how would we begin kind of backing into that type of strategy, right? And I think we have Mr. Kevin Wynn on the call with us here. Kevin, thank you for joining us today. Kevin is one of the exercise kinesiology partners that we work with very closely to support our maritime clients, kind of from a multiple different angles, but one specifically the pre-employment side. And Kevin, thank you again so much for hopping on the call today and sharing some of your knowledge. I would love for if you would kind of maybe lead the discussion on this slide as it relates to these two concepts that we think are just so important, which are the job task analysis as well as the physical demands testing strategy.
Absolutely. Thank you, Patrick. Appreciate the opportunity to chat here. Yeah, I've been involved with health work since 2018. Been involved in occupational health since 2010. My degree's in kinesiology. I'm a certified industrial ergonomic evaluator, but have really loved working in the maritime space just because the jobs are so unique, so demanding. And it's a little different. A deckhand for one company might be completely different than a deckhand for another company. Although they're doing similar tasks, every company has different processes and things like that. One of the things that I think is really, really important with job task analysis, especially the physical demands testing component, is consistency. I spoke to a really large international employer. One of their facilities, they have 1,500 employees. They have a staff on site, nurse practitioner, a nurse, and they perform fit for duty testing at this facility. We're not involved with them. They were just telling me their process. And I said, well, what happens when they have to go for fit for duty? They said, well, we have this job description. We give it to the employee. They go find a doctor that they want, and we have them take them through a test that they just kind of make up based on the job description. And I cringe because I know how inconsistent that process is. And from an EEOC standpoint, that's not best practice either. So I think the first part is, having consistent processes. And we want to test somebody physically in a clinic, and I think that fits in perfectly with what you all said earlier. What you see isn't what you get. I think the physical demands testing really shows what that individual can do and what they're capable of. And obviously, if they have any deficiencies, it's typically going to show up in that test. But that's all preceded by following the right steps. And so legally, per the EOC, we cannot test somebody for the physical demands of a job if we don't know what the physical demands for that job are. So all the testing is preceded by a thorough job description. Job task analysis, sometimes those are referred to as functional job descriptions, but that is an on-site review of the job. So not a phone interview, actually going out on site with a certified evaluator, measuring all the things that they have to lift, how many times they have to lift it, and coming up with a really good scope of what that job is. And a lot of times we love to just focus on lifting, but there's a lot of other components, especially in the maritime space. There's pooling, there's cardiovascular ability, there's climbing, there's crawling, there's really unique things per the Coast Guard requirements that individuals must be able to do. So we want to make sure that we are getting a really good, thorough understanding of those. And like I said, even though a deckhand is doing similar tasks, different companies have different equipment. And so what is a normal standard for one company might be completely different for another company. And so it's important that that evaluator goes on site, they perform that objective analysis, they define the essential job functions, and then they look at the physical components associated with each of those essential job functions. From there, we move into the creation of the physical demands test. So that's just a replication of that job in a really safe, controlled environment. And we cannot ask a candidate to do anything in that test that's not directly related to the job task analysis. Now, if that job task analysis shows that the individual must be able to lift up to 100 pounds, we would not be in a safe spot per the EOC if we required them to lift 125 pounds. We're asking them to do something that's above their job standard. However, if that 100-pound lift maybe is limiting a candidate pool in a tough job market, we can always test below that. So we just want to make sure that we're staying within safe guidelines and we're consistent across the board. I think having a company such as HealthWorks that's familiar with the unique demands of maritime space is very important. We've worked with companies that brought a physical demands test that they had created, but a company that maybe didn't really understand the space. And yes, they're doing tasks, but are they really specific to the job? Are they really vetting the individuals in the way that they need to be? So I think that's important. And then having consistent protocols that someone like HealthWorks can monitor and make sure that every test is being performed per the correct protocol, and we have consistency across the board. I think this is very true in a fit for duty situation. So especially, when we onboard a new hire in a post-offer employment test, we definitely want consistency, but I think even more so in a fit for duty situation where an individual has been hurt, they're off work and they're coming back to work. We want to make sure again that we have followed protocol, we have a good thorough job task analysis that is up to date, and that the physical demands directly reflects that job. Per the EOC, job task analysis and the test should be reviewed and updated if needed every 3 to 5 years. So another part of this process, once you're up and going, is going back every 3 to 5 years and making sure that those are updated in accordance with the current job description. Anything else to expand on there, Patrick or Dr. Turnbow?
No, man. I think that was a great rundown, Kevin. We really appreciate it, and I'm sure that'll trigger some other questions and conversations here down the road. But I think that really tees us up nicely for the next slide. So we understand, like, kind of step one is we got to build out the protocol, right? We got to understand the job description, the functional capacity of each job, build our physical demands test around that, which is going to nest with the medical physical, that we're going to perform. And I think, Dr. Turnbow, I'd really like to get, your insight. We're kind of zooming out here now, right? So we have our job task analysis. We know what our physical demand requirements are going to be. Kind of walk through, like, start to finish, what do we think a properly designed pre-employment physical experience would look like?
Sure. Yeah, I think we've been through lots of iterations of this as we have matured in trying to develop best case practices. I think, like everything, what you ask and how you ask it is extremely important. So I think we've developed a very robust electronic medical questionnaire, which has some AI behind it, which allows us to be able to identify potential problems and sort through massive amounts of questions and data to be able to ascertain which employees are more likely to need further evaluation, maybe further records need to be obtained, even before you spend time and money on things like the job task analysis or even the physical examination, drug testing, these type of things. And I think that's probably one of the most significant things that we've perfected.
Yeah.
I hate to say perfected because it'll change tomorrow. But, I think that was a really difficult task to design because we took into consideration at that point 35,000 different medications, and we utilized the Beers criteria and the United States Coast Guard medical recommendations on concerning medications. We have utilized criteria from the Coast Guard on what medical conditions are concerning for licensure, even for non-licensed candidates. What's good for the captain is probably good for others. If you're having known heart disease, it's important for us to know that before we put you into a strenuous environment. So I think that's step one. Know what you're getting, right? Do the best you can to give people opportunity to be fully open in this one opportunity that we have to do the post-offer evaluation. Getting all the records and information that we need ahead of time, vetting that out, and then when they come for the actual in-person physical examination, being sure that it's done consistently. You start with step one and you work all the way through those steps, which are designed really to start with a thing that eliminates most people. That's the drug screen.
Yeah.
Right. And so there's no need to spend time and money on a full physical and a physical job task simulation if they're not going to pass the drug screen.
Sure.
I think that's just kind of commonsensical. We've developed, we've done in various settings. We'll do the rapid drug screen and make them pass that before they meet later at a different time to collect the Department of Transportation required testing. I think that's been smart. It's been very helpful. It's helped us rapidly evaluate people and eliminate some potential candidates that weren't going to make it through anyways. And so the other thing I think from a medical evaluation is it's important for consistency, just like you're talking about and Kevin was talking about with doing the job task simulation and the physical demands testing. All that data, the evaluator in Baton Rouge or in New Orleans or in Paducah, Kentucky or St. Louis all have to do the exact same test the exact same way and input the data the exact same way for consistency. And so we have worked very hard to roll those programs out with partners that we trust, that we vet, that we continually monitor. They put the data into a centralized computer system that comes directly to us so that we can evaluate that, make sure that we're monitoring our EEOC metrics, that we're monitoring for potential discrepancies in one site versus the other from a discriminatory standpoint. And so that I think is very important. And you do the same thing when you're finding partners to perform the physical examination.
Yeah.
You want to be sure that they are aware of the type of work that we're doing, that they are familiar with the job descriptions for what we're sending, and they know the order in which we want them to do the testing and how to transmit that to us. And then really you have that data coming to a centralized medical director like our division We review that data, make sure it is consistent, it is complete, before then we give the clearance that they're okay to hire. And so that centralization, I think, has really worked extraordinarily well from a program that was, here, go to this doc in the box or that doc in the box and get a physical that nobody really knows if it matters or not, to something that is pretty regimented, consistent, and vetted by multiple different people.
Yeah. No, I think that's a great rundown. And the only other caveat, excuse me, I was going to add to that, you loosely hit this on the pre-screening side. The last numbers I looked at, I think we're up to about a 96, 97% clearance rate for candidates that we screen on behalf of our client partners. We know there's about a 96% chance that they're going to clear the medical physical process by the time we send them there, because just doing the homework. And I think that's up from 55% previously with a lot of our other partners who had 45% deferral rate.
Right. So just think about the savings in time and money that does with our team doing an appropriate medical questionnaire, appropriate medical vetting, all done remotely. While the patient is still, or the employee is still at their home base on their dime, not your dime, is a tremendous advantage.
Yeah, and we'll make some recommendations here at the end of this for, hey, I got it. Some of you guys out there, especially smaller operators, for what may not have the resources or current position to, bring on a more elaborate, medical program. To what we're speaking to, but we have some things that we're going to suggest that are good starts to be able to do this yourself, that we're excited to share as well. The only other thing I was going to mention, we talked about post-hire monitoring, or we mentioned post-hire monitoring here. The fact that if we get somebody through this entire process, we have their medical history, we benchmark their job task and their functional movement capacity, we've got them cleared right to go to work, it really makes it so much easier if we run into an issue with this person on the back end, right? And do you want to speak to that a little bit as far as the benchmark and return to work and all that?
One of the clinicians who takes the phone calls from the barges. It's really nice to have baseline medical history on people. So if you were to get injured or ill on a vessel, and I have access to all of the medical history and questions that we've already obtained. So there's a lot of disconnect there in most entities where, you may have one person formed in the post-offer testing, but then when they get injured, all of that data goes somewhere, never to be seen again. The thing that we have done well, I think, is integrating all of that data that we have collected and being able to design onboard healthcare, which we talked about at our last webinar, and then also designing wellness programs, because now you have a really good analytic data or aggregate data to be able to determine, where do we need to start with company A, B, or C. Perhaps, most of the time you're talking about obesity, tobacco abuse, those types of things, which are common. But mental health is a real significant issue in the maritime industry, and we're part of a number of initiatives trying to develop best case practices to screen and also to manage mental health while on and even after departing the vessel. I think the more data you have and the more you utilize that data to help it drive your initiatives, it just makes a big difference.
Absolutely. Well, okay, so this all sounds great, right? Like we kind of have a process, reads good, speaks well, on paper, it makes sense. But really what we're excited to share with you is some real world impact. So we just completed a year-long case study with another large employer that we're partnered with, where we have a lot of these programs in place. And we have some really compelling before and after data. So just a little background. This is a large employer, approximately 1,200 personnel that we started working with back in spring, May of 24. We implemented everything that we've ran down right here: a job task analysis program, a PDT program, and then a medical physical to match that. And then we fast forwarded essentially a year later, or almost exactly a year later, and we looked at, okay, what has happened to this organization from a injury perspective over that time period. And we got some pretty cool data to share. We'll kind of speak to a little bit here, but Cassie, let's go ahead and jump ahead. So really we focus on two things: our TRC rate, so total recordable cases, and then our DART rate, which is our days away in transferable or transfer issues, related to recordable injuries. Yep. So if you look there, we have a side-by-side comparison of where we started in May with the TRC rate of 1.48 down to 0.61. So, really we saw a 59% reduction over a 12-month period with this implementation. And then on the DART rate, it doesn't look as drastic, but it pencils out to 36% reduction in the DART rate as well, with overall a 30% reduction of, 36% decrease in comp claims over the course of that year. So we think that's pretty significant. From if you just looked at this through a safety lens, this is pretty impactful. Dr. Turnbull, I don't know if you have anything else you'd like to add to that as far as thoughts, comments on the data itself.
Depends on the type of employer and who their customers are.
Sure.
On OSHA recordability, certainly a lot of our clients are self-funded from the work comp standpoint. But regardless of who you are, it's hard to argue with reduction in injuries, right?
Yeah.
And whether or not they have to be away from work or they have to be transferred or reassigned, those type of things, really impacts operations in the maritime industry. So it's further validation that doing a organized medical screening program, hiring the right person for the right position makes a huge difference in outcomes. And if you keep doing the same thing over and over, you should expect the same results over and over. And this is just kind of nice for us. We have known this. We've had really good white papers and case studies on the impact. It was just nice to see with this year-long case study how impactful these processes really can be.
Yeah, it's exciting. We're excited to share this with everyone because it's pretty fresh off the press here.
I think this was our latest, or the newest large employer that onboarded.
Yeah,
and so we were excited because they were very excited. We didn't have to go and pull this out of their conference. They brought this to us.
Yeah.
Look how successful this implementation of this plan. And so we're pretty proud of that.
Yeah, and I mean, if you just loosely translate this data, our last case study that we shared in the Q1 discussion, we talked about the cost of offboarding. I know we're not specifically talking offboarding here, but we know from working with the rest of our industry, maritime, transporters, that on average, the average offboarding cost is about $30,000 between lost time and operations and then downstream claims cost associated with treating that patient. So you start applying these percentage reductions to those types of costs and lost operational values, that can be pretty significant.
Real money.
Yeah. So okay, we'll kind of round this out here because I really want to make sure we got some time for questions from the field here. But just real quick in summary, let's talk about best practice, right? If we're going to leave you guys with a bullet list of things that we would challenge you to do as operators to look at and evaluate or potentially implement. I mean, this is really what we're talking about. So as Kevin already spoke to, making sure that you have some sort of job analysis and testing program. We have to start with comprehensive, job descriptions that we can build a physical demand testing program off of. That would be step one, right? Step two, looking at some level of technology integration. And Dr. Turnbull, if you want to kind of rehash that, I think you kind of got into just the power of having a centralized funnel for managing this thing.
Yeah, I think we have done a good job at utilizing technology to be able to, no matter where the potential employee is in the world, they're going to get consistent collection of their information, consistent evaluation of their medical history. They're going to get consistent testing, whether they go to a physical therapist that we partner with in Maritime, or if they're in St. Louis or here in Paducah, and all of that data going into the same data bank so that we can analyze it and properly, opine upon it.
Yeah, yeah. And then, that really leads to kind of step 3 here, which is the just overall continuous improvement. Like, how do we use this data, right? How do we manage this data? Sometimes I'm a data geek, but I hate when we get into data and analytics and dashboards. Like, it's easy to get overloaded in today's world with data, but we really need a simple, concise, clear way to track and monitor what is going on with this data, this medical information for your organization. Once we get that built, we can do some really cool things with predictive analytics. I mean, we can tell you, hey, if you have this many vessels running with this amount of crew, you can expect ABC, right, at these ratios. So it just makes you more informed and better able to plan as operators when you have that type of site picture.
And I think this is just an aside, with the future of AI, as that we're starting to lean a little heavier in on utilizing AI to analyze data that we've had with 25,000, tools, and boat calls, as that was our previous discussion about taking care of people remotely on vessel, analyzing what the most common injuries and illnesses that we encounter and what are the most common outcomes. AI has been tremendously helpful in helping us analyze those 15,000 boat calls or whatever we analyze. And I'm just excited to see in the future, if you collect the data in an appropriate manner, what you can do with that. It should be powerful.
I'm going to put my futurist hat on here, but I know we've kind of geeked around with some of these conversations, Dr. Turnbow, but that makes me think about like the wearable biometrics and information that's flowing back to a medical provider or an operator or a safety leader that's saying, okay, hey, we have this benchmark. We know that we have a deckhand getting within the danger threshold of cardiovascular output or heat risk or heat intolerance and all the things we can do.
We're here in Kentucky today. It's about 97 degrees and about 99% humidity. I'm exaggerating, but it seems like that. And heat stress and heat-related illnesses are a real concern in any industry, but certainly in the maritime industry. So, we have certainly developed some protocols and some processes using wearable technology with Bluetooth connection to safety department and/or someone designated on the vessel to monitor biometrics and heart rate monitoring. And there's some very clear guidance there that heart rate monitoring can capture a heat event before it happens, and can allow you to remove them from that environment and get them proper hydration and cooling to prevent what is a huge issue with heat exhaustion and heat stress. Costs this country billions of dollars a year, just in monetary terms alone. Not to say anything about the impact it has on the individual.
Yeah, absolutely. Right into the next thing here, as far as number 4, compliance and risk management. Dr. Turnbow, you kind of hit at this already, but really just giving us the operators a solid foundation to mitigate some of this unfortunate risk that we know. Jones Act in and of itself is just such a beast, right? And we have seen a rise in EEOC and ADA claims with a lot of our maritime partners, but having this type of a program in place really helps us navigate that, right?
Yeah, it makes things much more defensible, right?
Yeah.
When you are consistent, you're fair across the board, you've established what the protocols are and what the necessary essential job tasks are, well documented those. You're always going to get challenges. So far, I think our programs have really stood up very well in that environment. But I think it's the way to practice. I think it's the way to be able to properly screen the employees and to make sure that you're doing the best job that you can to match the right person to the right job.
Absolutely. And last best practice here, we won't dive too far into this, but this really just sets the foundation for employee engagement and wellness. It really gives us a clear path and communication strategy regarding assessments. Really sets the foundation for some really cool things we can do with just proactive health and wellness initiatives. And then obviously recognizing and rewarding those safe behaviors and injury prevention at the larger scale is a benefit of all this as well. So I think we're getting really close to our Q&A. I don't know if we really have much to add on the regulatory and compliance. You kind of hit that already. Anything else you want to add there, Dr. Turnbow, as far as?
I mean, currently, as the United States Coast Guard's requirements are basically for licensed personnel to undergo the every 5-year evaluation and fill out the 719K. That is not trickled down to the deck, and I don't think it ever will. We're, in the Coast Guard rules and regulation, there's nowhere near a consistency and a uniformity that we would see in like the FAA or and now in the FMCSA with or DOT as it was known. And I don't know where we're going to get to that point. So I think there's a lot of burden put on the operators, the commercial operators, to develop their own protocols and processes to be able to protect the workforce and at the same time provide compliance. But really the compliance arm, as I understand it right now, is really just for the licensed personnel, and then being able to ensure even the non-licensed personnel are able to safely get off the vessel in the event of an emergency, which is pretty well defined.
Sure. Well, last couple minutes here, just quick summary, as far as key takeaways, traditional pre-employment physicals, there's risk out there as far as if you're not operating within some of these practices that we've outlined here today. The cost from an ineffective pre-employment eval is significant. In the maritime world, the consequences and outcomes and risk associated with just health and fitness are extremely high. We definitely want to see those job task analysis and physical demands testing programs in place. And then, takeaway message, just investing in better screening is going to reduce injuries, lower costs, and just improve your operational efficiency as an organization downstream, no pun intended. So let's talk about what you can do right now. So you got all this information. What are some things you could do internally as an organization to evaluate your pre-employment health strategy? So one, we would just ask that, look at your current pre-employment physical program. Like, what type of job descriptions do you have in place? What is going on with medical physicals? How are they being coordinated? Are they being coordinated in a post-offer manner? If you're a safety guy or operator on this call, a lot of those conversations probably need to start with your HR department as well, or your talent acquisition folks, getting them all in the same room to really whiteboard this out and kind of walk through what does that program look like from start to finish, so you guys can look at potentially any gaps that may exist there. Obviously, we're available. We conduct free consultations and kind of audits every single day with maritime clients all over the country. No obligation. If you wanted to schedule 30 minutes to sit down with me or Dr. Turnbow to kind of walk through your current program, we would love the opportunity to provide you some just no obligation feedback and thoughts on how you guys could potentially improve your programs. And then if you just want like a manual of things that, a little more detail of what we talked today, we do have a free maritime workforce health guide that you can download at HealthWorks Marine. We'll link that in the comments and the notes in this recording and send that out to everyone. If you're just looking for something you can pull off the shelf and maybe take a look at yourself on some things that you can self-implement. So I think we're rolling into our Q&A here. Again, if for anyone on this call that is interested, if you would like us to do just a free, no obligation audit of your program, bounce some ideas off of us and bend our ears, we would love the opportunity. Send us an email at service@healthworksmedical.com, and we would be glad to set that up. And look forward to potential conversations with anybody who's looking for support in that area. So, all right, Q&A. Here we are. I would love if there's any questions out there from the field, from what you heard today, please throw them in the chat. And myself or Dr. Turnbow, we'd be glad to kind of tag team these and provide you guys some feedback. So please throw some questions in the chat. We would love to answer those. I think we already have some questions that have came through here. Cassie's got some direct messages on questions that have come through just throughout the webinar. So we'll start off here. Yeah, it looks like we got a couple questions popping up here. So I guess I'll kind of take the first one here. Question is, how can employers ensure their healthcare providers understand the unique demands of working on a vessel or on the riverway? So Dr. Turnbow, do you want to kind of take that as a clinician? I think you kind of loosely hit that.
So I think it's important that the healthcare workers that you're using to perform these physical demand testing and or the actual physical examination need to have some, they need to do some walk downs. We make our folks go and actually walk the barge, have a walkthrough on what kind of work they're actually doing, what it looks like. A wrench is not a wrench in the maritime industry. It's it's huge, right? And the toes are very heavy. And so all clinicians need to have a better understanding of exactly what the task is requiring and the severity of making mistakes, what that looks like, and how important it is to have this physical ability, agility, and the mental fitness to be able to sustain 28 plus days on the river away from home. All of that is something that has to be taken into consideration. So we train our clinicians and our partner clinicians. We make sure that they have that information as well.
All clinicians aren't created equally, right? Unfortunately, it's I think it's important too, to your point, understanding the background of the folks that you're using. If we're sending folks to a walk-in urgent care clinic that has a nurse practitioner or PA in there, not to say they're not capable of doing that, but if their background is dermatology for their whole career, are they going to be equipped to understand the muscular and physical?
Or if they're in an urgent care where they get likely their compensation is tied to numbers, their ability to spend the amount of time necessary to do a thorough evaluation is probably less than ideal. I see a question from Kelly down there. How do you handle when they pass the physical demand test but have an unfavorable MRI? That's a great question. So MRIs are just a diagnostic information tool. So if I were to take 100 otherwise healthy people and perform MRIs on them, I'm going to find a lot of pathology, and that pathology may not ever mean anything, right? The vast majority of Americans are going to, certainly after the age of 20, 22, are going to have some degree of degenerative changes in their back. And MRI is typically good enough to find some sort of degenerative process, prior microfractures, things from young people do stupid things, they jump off large items, and then they have some microfractures that they would never know, they probably never knew, they're not likely to ever have long-term issues from that, but that's going to show up on MRIs. And so I guess my answer is you really have to take the MRI information in conjunction with the physical exam finding and the physical demands test to get a full picture. I think it's not wise to use just an MRI by itself to exclude someone from work, because sometimes MRIs that look pretty good, we find that those people have very poor functioning, and vice versa. Some MRIs that look absolutely terrible, the people are extremely fit, have very good functioning, very high range of motion and strength testing. So it is nice to have MRIs that have documentation of the baseline, right? So if they get injured and you hired them and they had an L4, L5 bulging disc when you hired them, but they met all the physical demands testing, they passed all the physical examination, and their strength and range of motion looks good, and then a month or two down the road they start complaining of back pain, and an MRI shows a bulging L4, L5, you can say, well, that's no different than it was when we hired them. So I think from that standpoint, it's very helpful. The other thing is, I mean, sometimes you see things that are going to be a no-go. I mean, if they have severe spinal stenosis, and you know that their risk is pretty high because of severe spinal stenosis, I don't really, just because they pass the physical demands test does not mean that they're actually safe.
Yeah.
In most instances, if we had an MRI that showed severe spinal stenosis, we would require those people to see their back doctor, essentially the neurosurgeon, orthopedic surgeon, and make sure that they sign off that they feel like they're comfortable and safe to perform the essential job test. I hope that answered what Kelly, your question.
And to your point, Dr. Turnbow, there's probably some risk inherently. If you're, Kelly, I don't know exactly the context you're coming from there, but, hypothetically, let's say if your organization is using a diagnostic imaging tool solely to screen, and you exclude somebody on behalf or as a result of that otherwise could be physically capable, now we're kind of getting into some of that. Yeah, going to be really challenging to defend.
Yeah, so but if you have an abnormal MRI and they have an abnormal examination or they can't pass physical demand test. So first of all, if they had an abnormal MRI and an abnormal exam, I'm not putting them through the physical demand test. We're done.
Yeah.
I would discourage people from trying to use imaging of any type as the only mechanism for screening, because that's going to lead to excluding a lot of people who didn't need to be excluded and allowing a lot of people who didn't need to be allowed. So you have to take it as one partial tool within a realm, which in my opinion would include physical demands testing, actual physical examination, review of the medical records, which is probably one of the most important things, and any imaging that you have available.
All right. I think we got a couple more minutes here. If any other questions out there, please drop them in the chat. We would love the opportunity to give you guys some feedback. I think we've had one or two more questions come through here just as direct messages. Let's see here. Here's a good one. Have you seen specific trends in musculoskeletal issues or other common disqualifiers that employers should be aware of? So anything jump out to you there, Dr. Turnbow? Like what maybe the most common disqualifiers that we see typically? This specifically says musculoskeletal.
Yeah.
But I know you kind of mentioned the drug testing program.
From a musculoskeletal standpoint, we always are very concerned when we see severe spinal stenosis.
Mm-hmm.
So people have bulging discs all the time. It doesn't necessarily mean anything. A herniated disc is a whole different ball game. Severe spinal stenosis is, in my opinion, a real high risk. So from a spinal standpoint, cervical stenosis or lumbar stenosis would be something that definitely gets our radar up, and we're going to take an even closer look at those candidates. Anybody who has a genetic tendency to a spinal instability, so people who have Chiari malformations, people who have axial ankle, which is the top portion of the brain where it rotates, if they have some instability of that, and there are some genetic conditions that can lead to that, those people need to be looked at very closely. Someone who has osteoporosis at a young age is a very concerning issue. Type 1 diabetics, are concerning. Not that we would discriminate them or that we would prevent them from being hired, but they need to have a very clear action plan on what they're going to do in the event of hypoglycemia, how they're going to monitor and manage this in a remote medical environment. Seizures are a real problem. You want to be sure, and the Coast Guard has some pretty clear guidance on people with a known history of epilepsy, when their last epilepsy episode was, how long they've been on medication, if they've been stable on the medication for long enough. All of that needs to be considered. One of the things that, and most interestingly, we've come across recently is people with severe food allergies. I mean, you're in an environment where you have one cook typically cooking for a number of people.
Yeah.
And if you have somebody on there who has a peanut allergy, what's their action plan? What's that going to look like? We have one that has a seafood allergy.
Yeah.
Well, what's that look like, and can we accommodate that kind of restriction safely in these environments? So those are the kind of things we kind of help the companies work through. What is a safe response to that? What's not a safe response to that? So that's off the top of my head.
Yeah, no, that's good.
From a musculoskeletal standpoint, anybody's had recurrent fractures, an unknown reason.
Mm.
Anybody who has prior hardware anywhere in their body, that can be a risk. So we look at all those very, very closely.
Yeah, good deal. Good stuff. I think, maybe time for one more question here, and we'll kind of wrap up. This is a good one. This came through. Somebody messaged this to Cassie, it looks like. How can smaller operators or companies with remote workforces implement this kind of program cost effectively? That's a great question. So I'll kind of take a stab at this. I think one of the first things you need to do is have the job descriptions and the job task analysis in place. Those things are relatively cost effective to implement. I think, I don't know what the market is. I think we charge a couple $100 per, job task analysis when Kevin or their team gets out there in the field to build those out. And I mean, they last you 5 years, 3 to 5 years, I believe Kevin said. But fundamentally, just having the foundation of those job descriptions and functional, capacity requirements in place will really allow you to kind of start stepping into this kind of this regimen and design of consistency, Dr. Turnbow, that you alluded to. I don't know if you have anything else that you would add.
I think that's very important. I mean, finding good partners who understand your industry and the nuances that are present in maritime work, I think is important. So if you have if you're a relatively small company and you have a local OCMED doctor or clinician who you can strike up a relationship with, bring them, have them do some walk downs on the vessels, understand the severity of the work and the scope of the work, and then kind of lean on them to help you screen out people who are going to be a problem or potentially going to be a problem. But that's how I would start. I think definitely it's hard for the clinicians that you're able to do that with to understand. But certainly if you send them off site to someone else who has no idea without an appropriate job description, it really becomes almost impossible.
Yeah. No, absolutely.
And the other thing I would say about that is, I think I may have alluded to this earlier, anybody can get somebody to clear them to return to work.
Mm-hmm.
I mean, it's not hard. You could be dragging your right leg behind you, and you can find somewhere a clinician to return you to work without any restrictions. So we don't take a lot of credit in that. We want to see the patients ourselves and make sure that they're actually physically fit.
Well, thank you so much for that. I think we're right at time, maybe a minute to spare here. So just wanted to thank everybody for joining us today. This is one of the favorite things that I get to participate in here. We love sharing this information with the field, with our workforce, with our clients, and just, anyone in the maritime space. Just reminder, if any questions, concerns, comments, if you want to engage us directly on anything that we talked about here today, or if you would like to bend our ear on feedback on how to better evaluate or improve your maritime specific health strategy, we'd love the opportunity to chat with you. Again, no obligation, no cost to do that. Just shoot us an email at service@healthworksmedical.com. And I believe we're also going to have the ability to kind of share this recording post-call. So if you want to circulate this with your teams and kind of share this conversation with your counterparts within your organization, please feel free to do that as well. So other than that, I think we're going to close it out. Dr. Turnbow, thanks for joining us today.
Thank you.
And Kathy, thanks for kind of hosting this and putting all this together and keeping us on track. And Kevin, thank you so much for joining us if you're still there today as well. Really appreciate your insight from the kinesiology and the physical therapy perspective as well. So yeah, thank you everyone. Hope you have a good rest of your day, and looking forward to hosting this again, another conversation here in the next couple months. Thank you. We're out of here.